Thanks, Brendan. In more news, the expected Supreme Court ruling that could overturn the constitutional right to an abortion invokes strong reactions from people with varying viewpoints. Some medical experts say if the ruling allows states to ban abortion, it could disproportionately affect the health of people in certain communities. And they tell Ashar Qureshi it's an issue that we need to be talking about.
This month, the Supreme Court is poised to reverse course on Roe v. Wade, which would allow states to ban most abortions for the first time in nearly 50 years.
These things that we call trigger laws that are on the books in certain states that are set up for when Roe falls, these laws go into effect immediately, and generally they banned all forms of abortion, even if the woman's life is at stake.
Linda Goler-Blount is the president and CEO of the Black Women's Health Imperative, a national organization focused on health equity and the health and wellness of Black women.
Until around Reconstruction, abortion was legal. It became illegal after slavery ended, but those landowners, former slave owners, said, well, we've got to keep up the labor force. And so abortion became illegal.
A piece of history studied and documented even by the National Institutes of Health.
Black women have disproportionately the greatest percentage of abortions. But that is due to the economic oppression and, frankly, the poor economic circumstances that we exist in now, but that are 400 years in the making.
At least 26 states are certain or likely to move quickly to ban abortion. 13 have laws in place that are designed to be triggered and take effect nearly immediately. In the leaked draft opinion obtained by Politico, Justice Samuel Alito writes in favor of overturning Roe v. Wade and says, quote, "A highly disproportionate percentage of aborted fetuses are Black. For our part, we do not question the motives of either those who have supported and those who have opposed laws restricting abortions." Still, healthcare providers across the country, like Central City Integrated Health in Detroit, are bracing for the disproportionate impact on Black women.
In communities like ours in Detroit and Michigan, we see those numbers as high as 52%. So 52% of women who have abortions happen to be Black.
Dr. Kimberly Farrow says Black women already have a maternal mortality rate 3 times that of white women. And in Michigan, a 1931 law criminalizing abortion, one of the strictest in the nation, could cause that to go up.
I think obviously what we're anticipating is an increase in those numbers of pregnancy-related deaths due to illegal abortions. I'm also afraid that we may see, return of people receiving, services in basements and, alleys and places where, medical professionals aren't present.
According to a recent study from Duke University, a ban on abortions could increase Black maternal deaths by 33%, compared to a 21% increase for the overall population. Primary care physician Aaron Miller says creating a patchwork of states that still provide abortion services will deepen the divide and further limit access to women who can't afford to travel across state lines for reproductive health care.
I take care of patients who don't even have a car to get across the city of Detroit to get to their primary care doctor's appointments. So if they need to travel to someplace like Illinois for an abortion, it'll be impossible.
Goler-Blount says the impacts will be far-reaching.
While this certainly it disproportionately impacts Black and brown women, this is also an issue of just poor women in general. This affects everybody.
For now, all eyes are on the High Court. Reporting from Detroit, I'm Ashar Qureshi.